Hi everybody, we're running really late, so this is going to be an absolute gallop from me. My name's Ruth Wilson. I'm currently covering Derbyshire for Macmillan, and we've got some really complicated patient flows across the county. We've got the top bit where people can be accessing the treatment in the Manchester, Stockport, Macclesfield areas. We've got the middle bit, which is Sheffield, Chesterfield, and further south we've got treatment centre in Derby. It's a mainly rural community with an ageing population who have to travel to reach treatment centres. But we've got some excellent services in the county that make a real difference for people. We've got Blythe House Hospice, which breaks the mould of perceptions of traditional hospice care and has the Living Well service there, together with the Macmillan Information and Support Centre. And clients and carers can access a huge range of support and activities, from acupuncture, complementary therapies, counselling, look good, feel better, mindful compassion, yoga, tai chi, walking for health, etc. Look them up on the website, or go and see Dr. Pauline Love, who's just going to wave at me there. She's one of the trustees there and a fantastic advocate for the hospice. So that's one. Going back to the hidden at home and the social care issues, we're working to open up more volunteer services and opportunities in the county. Volunteer Community Service Peaks and Dales is working closely with us, and there's Jill, who's running the Ready Call service, where they're offering practical, emotional, befriending and transport schemes for people affected by cancer. We've worked with them for nearly 4 years now, and we've extended the scheme into the north of the county, and it's going to be brilliant. We've linked in with the Farming Life Centre, which looks at the specific needs of that very stoical group of Derbyshire Hill farmers who are reluctant to access help and quite often see cancer as taking its course. So we're going to link in with them. We also link in with the Agricultural Centre at Bakewell with that team as well. The other news that we're working with Hardwick to look at extending that scheme into the Bolsover area so that we can cover that isolation and that problem that people find when they're in treatment for the disease. We've also got a service with Derbyshire County Council with their welfare benefits advice, and that's county-wide. So we've ticked off the financial support. And we've got Walking for Health across the county. The big news in Derbyshire is around the new build at Chesterfield. This is going to be great. It's going to be a hub for all the cancer services. People will still have to travel into Sheffield for some services, but it's something that we haven't had before. And the reasons why, you know what the reasons why are. The systems are under huge pressure. We've got a higher than average ageing population. And as we've said, you've seen these slides before, this is one of the advantages of going last. And this is what we're after with Macmillan, the 9 outcomes. And this is the stats that we got from the team. And I don't know if the team over there would like to just wave. That's Chesterfield. Okay, thank you. So the challenge now is there for us. We've got a new information and support service that's going to be brought in, and these are the photographs that we use for the launch of the appeal. So as you can see, it's cramped accommodation, unsuitable patient areas. There's the rising demands. People will get their treatments more locally. And we're going to look at redesigning the current services, and we're going to improve the patient support services. And there's a whole range of partners that are involved in that. It's been a really good working group, including, as you can see, the Derbyshire Cancer Action Group. I believe we have representation over there as well. Okay, so that's the aim, to provide the best possible cancer care for our patients. And that's the picture, the correct picture. And I don't know if you can see it, it's round the back, section 1 over there. So it'll bring all the services together. And as I say, we've got the Information and Support Centre, which we'll hope to replicate as many of those support services that we can. Okay. And that's what we want people in Chesterfield and North Derbyshire to experience. And that's Nikki James, the consultant nurse in neurology, with a lovely quote. She's been one of the driving forces behind it. And that's what patients want. That's what they tell us. They love the staff there. They do really, really well in the patient experience survey. So we'll transfer those qualities across. And that's the chemo suite. Okay? Does that do? Is that me? Get your lunch?